Good morning, and thank you, Elizabeth. I'm very excited to be partnering, collaborating with Moore Center colleagues, and I'll be telling you about our next project, which we hope will be funded soon and started soon. Um, I'm going to shift gears and talk now about a focus on potential perpetrators. Our project is a primary prevention initiative that will universally target all school adolescents around reducing their risk to go on to be perpetrators of child sexual abuse. My colleagues on this project are Dr. Letourneau and Catherine Bradshaw at the University of Virginia Curry School of Education, also previously here at Johns Hopkins Bloomberg School of Mental Health, Public Health Mental Health. So what I want to do today is I want to provide a rationale for the universal or primary prevention of child sexual abuse perpetration. So can we target potential perpetrators and prevent them from going on to become perpetrators? I want to make an argument for doing that with adolescents, not waiting until folks are young adults or adults. Doing that in a universal way, so touching everybody, not just those who are at risk. And I want to make the case for a mixed gender approach as well. After I hopefully convince you that that's a good way to go, I'm going to tell you about what we're planning, an intervention called the Responsible Behavior with Young Children program, and tell you about what we're planning for an initial feasibility study. Okay, so obviously child sexual abuse is a huge problem. It has a very high prevalence rate, and I don't think we're going to treat our way out of this in terms of waiting until sex offenders are identified as sex offenders and trying to remediate them from going and doing it again. As several folks have pointed out, many sexual offenses, folks don't have a previous history, right? So the first-time offender is accounting for a lot of the child sexual abuse that's occurring out there. So that alone sort of argues for a universal approach. So when you think about what we're doing already, and this is a huge, important endeavor, there's lots of universal school-based programs, again, universal being trying to work with every kid, not just kids who are at risk, school-based, classroom-based universal programs that are focused on children as potential victims. So like Dr. Mendelssohn's work, trying to help the child in this case learn how to protect themselves from perpetration. And so what these programs tend to do is tell kids about the problem, help them recognize when they might be in a situation where this is happening, resist that from happening, and also to report it. So it's a lot of content around good touch, bad touch, just saying no and getting out of the situation and telling a safe adult if somebody tried to touch you in that way. And as an extension of that work, there are some parent-focused approaches that are emerging. But for the most part, it's kids in classrooms hearing about this problem and making them aware and trying to help buffer them against it, or as some people have referred to it, target hardening. Right? These are the potential victims, and we want to harden them against being victims. So those programs, the science is not real well established here, but when we do that with kids in the classroom, we can improve children's knowledge that this is something that's out there that they should know about. And they do report up to about 1 year later some increased memory of the self-protection skills that they've learned. So they remember and learn they know what they're supposed to do if those things happen, right? And that's great. But unfortunately, at this point in time, we don't know whether those approaches actually reduce incidence rates. That's really hard to figure out. But do the kids who have those programs end up being abused less because they've been hardened against, they're more sophisticated, right? Versus kids who don't have those programs. We really don't know if it's effective in reducing their victimization. So why don't we actually try to prevent people from abusing, okay? And we're already very effectively preventing adolescents and young adults from going on to become other kinds of offenders. And we're doing that at the universal classroom level. And this is just a handful of approaches that have very long-term effects. I mean, these are interventions, classroom-based interventions for every kid in the classroom, that are focusing on various risk factors, social emotional learning, behavioral skills, good relationships with other people that end up having effects on criminal offending 10, 12, 15 years out. Okay, so we can prevent or have an effect on preventing later offending, robberies, burglaries, whatever, right? So it's not outside the realm of possibility. We could prevent folks from this kind of offending as well. Another sort of different research track is that school-based prevention is showing some very positive effects around preventing dating violence. So we can work with middle school kids, for example, and give them some skills for not having coercive sexual interactions with each other. And these are some examples of some of the researched and promising programs in that arena. So we can talk about sex with kids in schools to some very good effects here. So these sort of lay the framework, I think, for why don't we try to help kids prevent kids from going on to becoming juvenile sex offenders or adult sex offenders. Okay, so just this part's been mentioned already, that we prevent sexual abuse perpetration at the tertiary level pretty well. So Carol Pierce this morning mentioned that there are good cognitive behavioral approaches there where we can take somebody who's already offended and do a pretty good job of preventing them from doing it again, right? But the incident's already occurred. Similarly, the adaptation for MST, MST for problem sexual behavior, is working with adolescents. This is about our same target age group that we hope to target. Primarily like 11 to 14-year-olds in these studies, that if they've had an incident of a problem sexual behavior or a child sexual abuse incident, we can these kind of interventions help them from doing it again. That's great. So that's tertiary prevention or indicated prevention once kids are already identified. I'm going to now run you through an idea for a primary approach, reaching kids before they've been show any risk. Okay, so we want to focus on early adolescence. This would be sort of a middle school population, and our reason for that is that adolescents are perpetrators in about 36% of all CSA reports. So these are police reports or Child Protective Service reports. The official data, it's a huge chunk of the perpetrators from what we know from the legal system. We know that most of those perpetrators are between 12 and 14 years old, and most are males. So most are male adolescents. So, of course, lots of child sexual abuse doesn't get reported to Child Protective Services or to the police, and so it's harder to understand what's really happening out there for the unreported stuff. But we have two sources for that. If you do victim surveys, sort of nationally representative samples of young adults, and ask them if they've ever had child sexual abuse experiences historically, in those victim surveys, 50% report that their perpetrator was an adolescent. So their perpetrator was someone under the age of 18. That's a lot. That's much higher than the official rates. In our own work here, using the, I can't remember the new acronym, but the Prevention Intervention Research Center, the PERC data from the Bloomberg School of Public Health. These are huge samples of youth followed from first grade all the way through young adulthood, an epidemiological sample representative of all children in school here in Baltimore City. And we asked these kids tracked over time when they were in young adulthood, whether they ever had sex with someone younger than five or more years younger than them. And these are the rates that we got. 27% of boys report having done that with a younger partner, and amazingly 21% of girls by the age of 19 or 20 say that before they were 18, they had that experience. They had sex with someone who was 5 or more years younger. So there's a lot of kids out there. If we believe these data, there's a lot of adolescent child sexual contacts, many of which we would probably consider child sexual abuse. Really, I think, makes the case for a universal approach. Okay, well, but the rates are higher for boys. Why should we include girls in these efforts? Okay, as we said, they're accounting for about 20%. If you look at that group of folks, so there's a sexual abuse incident officially reported. 36% of those involve an adolescent perpetrator. In that group, about 20% are female. Okay, so that's a pretty big chunk. And then if you look at the sexual abuse that occurs in the context of a babysitting relationship. So somebody was actually caring for a child. These data are both adult and adolescent data. But still, in babysitting contexts, when CSA occurs in a babysitting context, a female is the perpetrator 23% of the time in that context. And girls have a slightly wider or older window of risk there, 12 to 17, for being a perpetrator of child sexual abuse. It's a little less concentrated, a little broader age group there. So we've got a fair number of girls out there engaging in some inappropriate sex with young people. And then more broadly, if a girl is not a child sexual abuse perpetrator herself, if you look at sort of the phenomenology of the way incidents, if you read reports and try to understand what actually happened in some of these incidents, often girls are sort of important context makers, right? The girl was the babysitter, her teenage boyfriend comes over, right? And the other kid is alone with the child and something happens. Or these two are having a sexual incident that somehow the children become involved in. So girls can create risky contexts for the perpetration of children, even if they themselves are not the perpetrators. And then the reality is that many of these girls are going to go on to be mothers, and so the kinds of interventions that Dr. Mendelsohn was talking about, we could get ahead of that by helping girls begin to think about their role as eventual mothers and the need to protect children then. So we think it makes sense to have a joint gendered approach to this and not just isolate the boys for primary sexual abuse perpetration prevention. Okay, so what would we potentially go after if we're going to try to bolster against this at the universal level? Nothing's actually happened with these kids yet, right? But I think if we look at the treatment literature, we can make some inferences about some targets here. So juvenile sex offenders have these kinds of problems that before they offend are probably leading the way to offending. So we know that juvenile sex offenders have lower sex knowledge, lower knowledge of developmental differences, so they just don't kind of get that younger kids are not the same as them. And they have other kinds of cognitive distortions, like a child took her clothes off in front of me and that meant she wanted sex, kind of related to the developmental difference thing. But when you talk to juvenile sex offenders, these are the kinds of things that come out about why these incidents occur. At the family level, Dr. Mendelsohn laid these out very well, that we tend to see families where there's not good communication about sex, where parents are not monitoring these situations where older kids are alone with younger kids. And really, there's a lot of information across different research literatures around just not having explicit rules against stuff. If we don't create norms around this, nature abhors a vacuum, right? And just by not sort of saying, this stuff is not okay, we're making things riskier just because we don't make explicit rules against it. There are some peer, school, and contextual factors that we could possibly address as well. Again, at the peer level, we don't talk about this stuff, so kids don't know that it's not okay at the peer level to do these things. Schools don't talk about kids as potential perpetrators, and then there's some contextual stuff that we could at least make kids aware of. That whenever substance abuse is involved, these kind of things are more likely to happen, or when you're alone with kids, these things are more likely to happen. So here's what we want to do. We have an application in right now, myself with Dr. Letourneau and Dr. Bradshaw, to NICHD for a small pilot study which would involve 4 Baltimore City classrooms. Sorry, I think it's 2 schools and 4 classrooms of 6th and 7th graders. Oh, sorry, 8 schools. Right, 8 schools, 4 classrooms. And what we're going to do is we're going to hopefully target the health classroom, the sex ed classes in those schools, and randomize the classrooms to either receive our intervention or not. We're calling the intervention the responsible behavior with young children. Notice that the words perpetration, offending, and child sexual abuse are not a part of our title. I'll tell you more about that in a minute. But this is a really relatively low-cost, manageable intervention, running about 10 weeks, 1 time a week in that sex ed classroom, 10 weeks to get through 8 modules of about 30 minutes each. We're going to use, instead of using the classroom teacher, the sex ed teacher, for this initial launch, we're going to go ahead and use trained prevention interventionists. There's a lovely, huge network in the Bloomberg School of trained prevention specialists who have a lot of experience delivering those juvenile offender kinds of interventions in the classroom. So we're going to work with those first and potentially generalize to teacher-administered programs later. But we'll have teachers highly involved, organic school teachers highly involved. We're going to incorporate core techniques from effective classroom-based programs. The ones that have been effective around preventing other kinds of offending, we're going to incorporate their ideas around lots of behavioral rehearsal, lots of norm setting in the classroom, things like that. Okay, so I'm going to run you through sort of how we're envisioning this curriculum, and we're calling it responsible behavior with young children. We're going to pitch this thing to schools and to parents and to the adolescents themselves as a way of learning more about young children and being responsible with young children generally. Okay, so we are citizens in this world. Most adolescents have some contact with younger kids, and how do we manage those relationships? How do we make sure they're healthy and safe in a broad way? And under that umbrella, we will talk quite explicitly about the need to protect these children sexually. Okay, so that's kind of the goal of the course. It's just having good, responsible, and healthy relationships with younger kids. We're going to spend a fair amount of time before we talk about sex just laying out some of the developmental differences between a 12 to 14-year-old and kids that are 10 and under. It's really quite different, right? And help adolescents have more empathic responding about little kids really don't understand that they're not as sophisticated as you guys are. They don't know that taking clothes off, they have no sexual meaning when they take their clothes off or rub up against you or kiss you, right? It's a whole different thing when you're a kid. And then once we kind of lay some basic developmental difference groundwork, we're going to get into actual defining of CSA and dispel some of the myths around it. So this happens. Adolescents sometimes do this thing. It's not just creepy guys in the park, right? It happens in our homes and in our churches, and really kind of school adolescents up about this, and walk them through sort of the individual and situational reasons these things happen. Then we're going to spend a fair amount of time talking about bystander effects. So really trying to hit those girls and other people that might be around when these incidents happen. There's many contexts where there's lots of kids around when the child sexual abuse occurs. And how do you know if you're a bystander? How do you know if a situation is risky? How do I, developing some skills around bringing adults in or trying to stop a situation that is occurring. We're going to spend a little bit of time applying some of the it's not okay to do this stuff to relationships with peers. So we're going to have a little sort of peer-to-peer sexual or dating piece, which is in part because schools are very concerned about gender-based or sort of sexually tinged behaviors in the school. Boys snapping girls' bras, girls making fun of boys' penis size. I mean, those are the kinds of problems that schools are dealing with. We're going to give them a little bit of support around that. And really try to end strong with a strong classroom and norm statement against this. We all are sort of committing as a school to being responsible stewards of younger children. We are at this school. Our adolescents are good to little kids, and we go out of our way to protect them. So creating a norm around that. I'm really excited about the parent piece of this intervention. We're going to try to keep it, it's primarily in the classroom, but we're going to have these homework assignments that will engage parents in this work. So the first thing, these are kind of scattered throughout the 8-week intervention. So we're going to have the adolescent go home and do a homework assignment where they make a roster of all the young children in their life, which is to begin to sensitize parents to the potential risky context that this adolescent has. It turns out this adolescent does do a lot of babysitting, or there are a lot of cousins around on the weekends, right? And so just to begin to understand the contacts that this teen is having with younger children. And then to begin to do applying some of the perspective taking and developmental difference stuff with actual kids in the teen's life. So the parent is going to facilitate some conversations about, yeah, your little cousin is really different, right? And we've talked about this. And eventually moving up to parents having information. The teen is going to teach the parent about child sexual abuse. So they're going to have their own myths dispelled around it, very similar to your curriculum, Dr. Mendelson, but the kids teach the parents about that. And then we're going to have parents facilitate a homework assignment where the parents make a strong expectation that kids not do this. Same kind of thing that, the school pledge and also the family pledge. That in our family we don't do this. In our family we protect younger children. Yeah, so I think that's pretty much all. This is just, I'm running out of time, so I'm gonna just lead this up. But basically we've got, it's a relatively small pilot study. It is going to involve random assignment. And we've got some proximal indicators. Again, we don't expect this intervention, in the time that we have for the study at least, to show any actual prevention on incident rates for the kids we work with. But the intermediate things along the way we think that we can shift after 8 weeks are the following: that we can hopefully have these kids have fewer cognitive distortions about sexual interactions with younger children, raise awareness about bystander issues, things of that nature. So in the interest of time, I'm going to go ahead and stop. I'd love to talk with, and I should say this briefly. We really want, as we go here, the study is designed, before we get started, to have a lot of focus group and a teacher, school administrator, and parent input into this curriculum. So we have a rough idea for the curriculum, but we want to really have lots of conversations in a systematic way about making sure it's acceptable and feasible to all those stakeholders, and changing the content as necessary, so that we make this okay for schools and parents to have their kids receive. Okay? So thank you. I'd love to talk about it over lunch if anybody has questions. Okay, thank you.